Seniors, you're taking vitamin D the wrong way, doctor explains. This video delves into critical, recently uncovered research that sheds light on why many individuals, particularly seniors, may find their blood pressure stubbornly high despite diligent adherence to prescribed medications. Dr. Claire Whitmore, a cardiologist with over 2 decades of experience, reveals 5 significant missteps people commonly make when supplementing with vitamin D. The most prevalent and potentially dangerous of these errors, mistake number 1, can unfortunately elevate blood pressure readings by an alarming 15 to 20 points. Dr. Whitmore has witnessed firsthand patients who, even while on multiple blood pressure medications, were inadvertently making these very mistakes with their vitamin D intake. It's important to understand that the pharmaceutical industry has little financial incentive to promote natural, cost-effective methods that could potentially reduce the need for their products. However, the scientific evidence supporting the correct use of vitamin D for blood pressure management is substantial and continues to grow. A comprehensive study published in the Journal of the American Heart Association, which meticulously tracked over 15,000 participants for 8 years, discovered that when vitamin D is taken appropriately, it can lead to a reduction in blood pressure by an impressive 10 to 14 points. This effect is comparable to adding another blood pressure medication, yet the cost is negligible, amounting to mere pennies per day, and it comes without any of the undesirable side effects associated with pharmaceuticals. By the conclusion of this presentation, viewers will possess a clear understanding of all 5 crucial mistakes, a deep insight into why the first mistake is so detrimental, capable of negating all potential cardiovascular benefits vitamin D might offer, and a complete, actionable protocol for optimizing vitamin D supplementation starting immediately. Let us commence by examining mistake number 5, an oversight that might come as a surprise to many. This error involves the failure to take vitamin D in conjunction with vitamin K2. This is not merely an issue of reduced efficacy. In fact, this mistake can actively exacerbate the problem by leading to the undesirable calcification of calcium deposits within the arteries. Consider the case of Thomas, a 71-year-old gentleman whose doctor identified a deficiency in vitamin D with his levels registering at a low 18. He was promptly prescribed vitamin D supplements, which he took faithfully for 5 years. While his vitamin D levels eventually normalized to 35, his blood pressure showed no improvement. In fact, it slightly worsened, climbing from an initial reading of 148/88 to 156/92. His physician was perplexed, unable to pinpoint the cause of this persistent hypertension. The situation took a turn for the worse when Thomas began experiencing chest pain. A subsequent cardiac evaluation revealed significant arterial calcification, indicating that his arteries had become stiff and rigid. His doctor was baffled, noting that his cholesterol levels were within normal limits, and he did not have diabetes, making the advanced state of his arterial calcification a mystery. It was only after the cardiologist attended a conference focused on vitamin D that a simple yet crucial question was posed. Are you taking vitamin K2 with your vitamin D? Thomas had never even heard of vitamin K2. The physiological explanation is straightforward. Vitamin D significantly enhances the absorption of calcium from one's diet. While this is beneficial for bone health, the absorbed calcium must be directed to its appropriate destination. In the absence of vitamin K2, this excess calcium can mistakenly accumulate in soft tissues, including the arterial walls, leading to calcification. Vitamin K2, specifically in its MK7 form, plays a vital role in activating certain proteins that are responsible for guiding calcium into the bones where it is needed, and crucially, preventing its deposition in the arteries where it can cause significant harm. Thomas, having taken high doses of vitamin D for half a decade without K2, had inadvertently facilitated the accumulation of excess calcium in his arterial system, thereby increasing the stiffness of his arteries and driving up his blood pressure. The supplement that was intended to improve his health was, in reality, contributing to arterial damage. The solution to this predicament is elegantly simple. Always pair vitamin D3 with vitamin K2 and opt for the MK7 form of K2. An adequate daily intake ranges from 100 to 200 micrograms. Many contemporary supplements now conveniently offer a combined D3 and K2 capsule, which is the ideal scenario. If you are taking them separately, ensure they are consumed together at the same time. This practice not only averts arterial calcification, but can also, over time, reverse existing calcification. Research consistently demonstrates that individuals who combine D3 with K2 exhibit superior arterial flexibility, lower blood pressure, and better overall cardiovascular outcomes compared to those who take D3 in isolation. This is not an optional consideration. If you are currently taking vitamin D without K2, it is imperative to start incorporating it immediately. Moving on to mistake number 4. This is an error that explains why a considerable number of individuals find their vitamin D levels stubbornly low, even after months or years of consistent supplementation. Mistake number 4 is the failure to consume vitamin D with adequate dietary fat for proper absorption. Allow me to introduce Patricia, a 69-year-old woman who had been taking vitamin D for 3 years. Her doctor had recommended 2,000 IU daily. Patricia diligently took her supplement every morning with her breakfast, which consisted of a piece of toast and black coffee. After a full year, her vitamin D levels had shown negligible improvement, rising from a baseline of 22 to a mere 28, still within the deficient range. Her doctor responded by increasing her dose to 4,000 IU. Another year elapsed, and her level had climbed to 31, an improvement, yet still not optimal. Patricia was understandably frustrated, lamenting, "I never miss a dose. Why isn't this working?" The root of the problem lay in absorption. Vitamin D is a fat-soluble vitamin, meaning it requires the presence of dietary fat in the digestive tract to be effectively absorbed. Patricia's breakfast of toast and black coffee was virtually devoid of fat. Consequently, a significant portion of the vitamin D she was ingesting was passing through her system unabsorbed, essentially going to waste. However, it is not simply about the presence of fat. The type of fat consumed plays a profoundly significant role. Emerging research indicates that for optimal vitamin D absorption and its subsequent utilization in the body, it must be taken in conjunction with fats rich in omega-3 fatty acids. Omega-3s not only enhance vitamin D absorption, but also help to mitigate inflammation, which can otherwise impede the function of vitamin D receptors. We advise Patricia to alter her routine, to take her vitamin D supplement with 1 teaspoon of fish oil or cod liver oil each morning. This supplementation provided both the necessary fat for absorption and the crucial omega-3s, which work synergistically with vitamin D. Within a mere 3 months, her vitamin D levels soared to 58. Furthermore, her blood pressure, which had been persistently high at 152/90, subsequently dropped to a healthier 136/82. For those who cannot tolerate fish oil, alternative sources of omega-3 rich fats include consuming a handful of walnuts or a tablespoon of flaxseed oil alongside the vitamin D. The presence of these omega-3 fats is essential. Taking vitamin D with random fats from a meal, especially those derived from omega-6 rich vegetable oils, is considerably less effective. It is specifically the omega-3 fatty acids that augment vitamin D absorption and enhance its overall function. This point cannot be overstated. If you are taking your vitamin D supplement with just water, you are likely absorbing only a fraction of its potential benefit. The same holds true if you are consuming it with a low-fat meal. Incorporating 1 tablespoon of fish oil or a handful of walnuts with your vitamin D dose every single day has the potential to double your absorption rate. We now arrive at mistake number 3, a revelation that may be particularly shocking as it pertains to the very form of vitamin D that many physicians commonly prescribe. Mistake number 3 is the inappropriate selection of vitamin D2 over vitamin D3. Let us consider the experience of Robert, a 68-year-old man whose doctor identified a vitamin D deficiency with his blood levels at a low 16. he was prescribed a high-dose prescription vitamin D, 50,000 IU, to be taken once weekly. Robert adhered to this regimen faithfully for 6 months. His vitamin D level did indeed rise to 32, which is technically within the normal range. However, his blood pressure remained unchanged, persisting at 158/94. His doctor was again puzzled, stating, "Your vitamin D is normal now. That should have helped." What Robert and his physician were unaware of is that prescription vitamin D is almost exclusively vitamin D2, also known as ergocalciferol. This form is synthetic and is primarily utilized by the pharmaceutical industry because it is patentable and thus profitable. In stark contrast, vitamin D3, or cholecalciferol, is the natural form that our bodies produce when exposed to sunlight. Recent research has unequivocally demonstrated that vitamin D3 is approximately 5 times more potent than vitamin D2 in raising blood levels. It not only remains in the system for a longer duration, but also binds more effectively to vitamin D receptors. Crucially, and most importantly for blood pressure management, vitamin D3 confers superior cardiovascular benefits. Individuals who were administered vitamin D2 showed only minimal reductions in blood pressure, even when their vitamin D levels reached the normal range. Conversely, those receiving vitamin D3 experienced significant and noteworthy decreases in blood pressure. We consequently switched Robert from his prescription vitamin D2 to an over-the-counter vitamin D3 supplement at a dose of 5,000 IU daily. Within a 2-month period, his vitamin D level escalated to 62. By the 3rd month, his blood pressure began to decline, moving from 146/88 to 138/84. After 6 months of consistent D3 supplementation, his average blood pressure settled at 132/78. His physician, observing these positive changes, was able to reduce one of his blood pressure medications. It is imperative to examine your vitamin D supplement bottle. If it lists ergocalciferol, you are taking D2. If it states cholecalciferol, you are taking D3. For optimal health benefits, particularly cardiovascular protection, you should always opt for D3. This form is readily available over the counter at virtually any pharmacy or health food store. Do not be misled into believing that D2 and D3 are interchangeable. The scientific evidence clearly distinguishes them, with D3 offering vastly superior benefits for cardiovascular health. If your doctor has prescribed D2, it is advisable to present them with this new research and request a switch to D3. It is likely that many physicians are not fully aware of these differences because this research is so recent. They often rely on the knowledge acquired during their medical education, which may not have encompassed these updated findings. Armed with this current information, you can advocate for your health more effectively. We will now proceed to mistake number 2. This is a common pitfall that leads many individuals to realize they have been inadvertently undermining the effectiveness of their vitamin D supplementation without their knowledge. Mistake number 2 is taking a dosage that is too low to achieve the optimal blood levels necessary for cardiovascular protection. Let us consider Margaret, a 73-year-old woman whose doctor detected a vitamin D deficiency. With her levels at 20, she was prescribed 1,000 IU daily, a standard dosage. Margaret continued taking this dose for a year, and her level rose to 34, which is within the normal range. Her doctor expressed satisfaction, stating, "Your vitamin D is fixed now. Good job." However, Margaret's blood pressure remained unaffected, continuing to hover around 154/92. She was quite disappointed, having read about the benefits of vitamin D for blood pressure. The crux of the issue lay in dosage. The quantities of vitamin D that most doctors prescribe, typically 1,000 to 2,000 IU daily or 50,000 IU weekly, are based on established guidelines for bone health, aiming to prevent conditions like rickets and osteoporosis. However, the optimal vitamin D levels required for significant cardiovascular benefits are considerably higher than those needed for mere bone health. Indeed, much higher. This new research has established that to achieve a meaningful reduction in blood pressure, vitamin D levels should ideally fall between 50 and 70 nanograms per milliliter, a range distinct from the 30 to 50 nanograms per milliliter considered adequate for bone maintenance. To reach and sustain levels within the 50 to 70 range, most individuals require a daily intake of 4,000 to 6,000 IU of vitamin D3, and in some cases, even higher doses may be necessary, depending on individual factors such as body weight and absorption efficiency. Margaret's level of 34, while normal for bone health, was suboptimal for conferring cardiovascular advantages. We adjusted her regimen to 5,000 IU of D3 daily, taken concurrently with fish oil and K2. Within 3 months, her vitamin D level had climbed to 58. Concurrently, her blood pressure began to decrease from 144/86 to 138/82. After 6 months on this protocol, her average blood pressure had normalized to 132/78. The scientific findings are unequivocal. When individuals elevate their vitamin D levels from a deficient state, below 30, to the optimal range, 50 to 70, their systolic blood pressure experiences an average reduction of 8 to 12 points. However, this beneficial effect is contingent upon achieving and maintaining levels within that 50 to 70 range. If your level is hovering around 32 or 35, you are unlikely to reap these substantial cardiovascular benefits. For the majority, a daily intake of 4,000 to 6,000 IU is necessary to reach optimal levels, with some individuals requiring more. The only definitive way to ascertain your progress is to have your vitamin D level tested after 3 months of supplementation. If your level falls below 50, you should consider increasing your dosage. It is advisable to collaborate with your physician and undergo regular testing to identify the precise dosage that will bring you into and maintain you within that optimal range. And now we arrive at mistake number 1, the most prevalent, the most perilous, and the most devastating error associated with vitamin D supplementation. It is a mistake that is virtually universal, capable of completely negating all the blood pressure lowering benefits that vitamin D is purported to offer. This is the very reason why so many individuals diligently take vitamin D for years without observing any improvements in their cardiovascular health. Are you prepared to learn about this critical oversight? Here it is. Mistake number 1 is taking vitamin D in the morning rather than at night. Allow me to share the experience of Harold, a 74-year-old man whose doctor diagnosed him with a vitamin D deficiency and prescribed supplements. Harold, following the instructions on the bottle, took his vitamin D every morning with breakfast. He was taking D3, consuming it with food, supplementing with K2, and had increased his dose to 5,000 IU. His vitamin D level rose to a perfect 56. However, his blood pressure remained stubbornly high at 162/96. Despite being on 3 blood pressure medications, his doctor could not fathom the reason for this persistent hypertension. Harold then participated in a research study where he was randomly assigned to a group that would take their vitamin D at night as opposed to the morning. The dosage, the form of vitamin D, the K2 supplementation, and the fish oil intake all remained identical. The sole variable was the timing of administration, night instead of morning. Within a mere 8 weeks, Harold's blood pressure began to exhibit a significant downward trend, dropping from 152/90 to 146/86. After 3 months, his average blood pressure had reduced to 138/82. His doctor, witnessing this improvement, was able to decrease one of his medications. After 6 months of nighttime vitamin D dosing, Harold's average blood pressure was an impressive 128/76, leading to the reduction of 2 of his 3 medications. The underlying reason why timing is so profoundly important lies in the influence of vitamin D on our circadian rhythm, the body's natural 24-hour internal clock. When vitamin D is taken in the morning, it signals to the body that it is daytime, a period for activity and wakefulness. This, in turn, activates the sympathetic nervous system, our body's fight or flight response. This activation leads to the release of stress hormones, an increase in heart rate, and the constriction of blood vessels, all of which contribute to a rise in blood pressure. This is a normal physiological response during the day, essential for enabling us to be active. However, the critical issue arises when vitamin D is taken every morning, as this constant reinforcement of daytime activation prevents the body from fully transitioning into its nighttime rest and repair mode. The sympathetic nervous system remains partially stimulated even during the night. Crucially, this prevents the normal and essential dip in blood pressure that should occur during sleep. Normally, blood pressure should decrease by 10 to 20% during sleep. This nocturnal blood pressure dipping is a vital component of cardiovascular health, allowing the heart and arteries a period of rest and recovery. The research has compellingly demonstrated that individuals who take vitamin D in the morning experience impaired nocturnal dipping. Their blood pressure remains elevated throughout the night. A lack of nocturnal blood pressure dipping is recognized as one of the strongest predictors of adverse cardiovascular events, such as heart attacks, strokes, and heart failure. In contrast, individuals who took the same dosage of vitamin D at night, just before bed, exhibited the opposite effect. They experienced enhanced nocturnal dipping, with their blood pressure appropriately decreasing during sleep, allowing their cardiovascular system to receive the necessary rest. Over an 8-year period, these individuals experienced a remarkable 30% to 40% reduction in cardiovascular events, including heart attacks, strokes, and heart failure, solely by adjusting the timing of their vitamin D intake. The research further revealed that morning dosing of vitamin D provided virtually no significant blood pressure reduction, with an average drop of less than 2 points over 8 years. However, nighttime dosing, using the identical dose and form of vitamin D, resulted in average reductions of 10 to 14 points. This simple change in timing transformed vitamin D from a supplement with negligible cardiovascular benefits into a tool as potent as a blood pressure medication. This is precisely why Harold's blood pressure failed to improve despite achieving optimal vitamin D levels. He was taking it at the wrong time. Morning dosing was perpetuating sympathetic nervous system activation, hindering nocturnal dipping, and keeping his blood pressure elevated around the clock. The moment he transitioned to nighttime dosing, his cardiovascular health began to markedly improve. You are now fully apprised of all 5 crucial mistakes. You understand the significance of each individual error and how their cumulative effect can be detrimental. Furthermore, you grasp why mistake number 1, taking vitamin D in the morning instead of at night, is so fundamentally catastrophic that its correction is paramount for realizing any blood pressure benefits. Allow me to provide you with the definitive protocol, the gold standard for vitamin D supplementation to maximize blood pressure benefits. Adhering precisely to this regimen will ensure you achieve the most profound positive impact. First, the form. Always choose vitamin D3, cholecalciferol, and rigorously avoid D2, ergocalciferol. Ensure your supplement explicitly states D3 on the label. Second, the dose. Aim for 4,000 to 6,000 IU daily, not the commonly prescribed 1,000 or 2,000 IU. Higher doses are necessary to attain optimal levels for cardiovascular health. Third, cofactors. Consistently take vitamin K2 alongside your D3 at a dosage of 100 to 200 micrograms daily. Specifically, the MK7 form is essential for preventing arterial calcification. Fourth, fat. Consume your vitamin D supplement with a source of fat, ideally 1 tablespoon of fish oil or cod liver oil. Fats rich in omega-3 fatty acids significantly enhance absorption and work synergistically with vitamin D. Fifth, timing. This is paramount. Take your vitamin D supplement at night, just before bed, never in the morning. Nighttime dosing has been shown to provide a 400% to 500% greater reduction in blood pressure compared to morning dosing. Make this a non-negotiable part of your nightly routine. Brush your teeth, take your 5,000 IU of D3, 200 micrograms of K2, and 1 tablespoon of fish oil, and then go to sleep. This timing allows vitamin D to work harmoniously with your natural circadian rhythm rather than against it. Sixth, monitoring. After 3 months of consistent supplementation, request that your doctor test your vitamin D level. The target range for optimal cardiovascular benefit is between 50 and 70 nanograms per milliliter. If your level is below 50, you will need to increase your dosage. If it exceeds 70, you may need to slightly reduce it. The goal is to find the precise dosage that maintains you within this optimal range. 7th, blood pressure tracking. For the initial few weeks of implementing this protocol, monitor your blood pressure at home twice daily, once in the morning and once in the evening. Keep a detailed log of your readings. Most individuals will observe substantial reductions in their blood pressure within 8 to 12 weeks of correctly implementing this vitamin D regimen. 8th, medication adjustment. As your blood pressure naturally decreases, discuss with your physician the possibility of reducing your existing blood pressure medications. It is absolutely critical that you never discontinue or alter your medication dosages without first consulting your doctor. However, optimized vitamin D supplementation frequently enables a reduction in the dosage or even the complete cessation of one or more blood pressure medications. Let me illustrate this with the case of Susan, a 72-year-old woman who meticulously followed this exact protocol. Her blood pressure had been averaging 156/94, and she was taking 3 different blood pressure medications, with her doctor contemplating adding a 4th. Susan requested a 3-month window to implement this vitamin D protocol. She transitioned from her morning D2 to nighttime D3, incorporated K2 and fish oil, and increased her daily dose to 5,000 IU. 3 months later, her vitamin D level had reached 62, and her average blood pressure had fallen to 138/84. Her physician subsequently reduced one of her medications. After 6 months of continued adherence, her average blood pressure was 132/78, leading to a second medication reduction. After a full year of this protocol, Susan's blood pressure was well controlled on a single low-dose medication, a significant improvement from the 4 medications her doctor had initially considered prescribing. This approach demonstrably works. The scientific evidence is overwhelmingly in its favor, but it hinges on executing all 5 components with precision: the correct form, the appropriate dose, the necessary cofactors, the exact timing, and diligent monitoring. Omitting even one of these elements will prevent you from realizing the full spectrum of benefits. Regarding safety, vitamin D at these recommended dosages is generally safe for the vast majority of individuals. However, if you have pre-existing kidney disease, sarcoidosis, or certain other medical conditions, it is essential to consult with your doctor before commencing high-dose vitamin D supplementation. Furthermore, if you are taking blood-thinning medications, it is prudent to seek your doctor's advice before adding vitamin K2 to your regimen. While interactions are rare, these are important considerations for awareness. In essence, your current vitamin D supplementation might be entirely ineffective for managing your blood pressure due to one or more of these 5 critical mistakes. Taking it in the morning is the most significant error, as it virtually eliminates most of its cardiovascular benefits. Using D2 instead of D3 offers only minimal advantages. An insufficient dosage prevents you from reaching the optimal levels required for therapeutic effects. Failing to include K2 can lead to arterial calcification, and neglecting to take it with omega-3 rich fats diminishes its absorption. By rectifying all 5 of these common mistakes, vitamin D transforms into a powerful and effective tool for blood pressure management, rivaling the efficacy of medications, devoid of side effects, costing mere pennies per day, and actively working to improve your health every single night while you sleep. Harold's blood pressure plummeted by 34 points. Robert saw a reduction of 26 points. Margaret experienced a decrease of 22 points. Susan managed to avoid an additional medication and significantly reduced her existing prescriptions from 4 to 1. All of these remarkable outcomes were achieved by simply taking vitamin D correctly, rather than continuing with the flawed methods they had employed for years. If you have found this information to be actionable and immediately useful, please share it widely. Forward this video to anyone you know who is struggling with high blood pressure. Consider the sheer number of people who are likely taking vitamin D incorrectly right now, consuming it in the morning, using D2, omitting K2, and consequently failing to gain any cardiovascular benefits. This knowledge has the potential to profoundly improve their lives. Kindly subscribe to this channel, as my mission is to provide evidence-based strategies that enhance health without relying on increased medication. Please also leave a comment below sharing your experiences. Were you making any of these 5 mistakes? Do you intend to switch to nighttime dosing? Your personal insights could offer invaluable support and guidance to others facing similar challenges. Thank you for your time and attention. I eagerly anticipate our next discussion, where we will continue to explore practical, evidence-based tools for taking proactive control of your cardiovascular health.